If you've ever considered a smile makeover, you've likely faced the exact same anxiety. You sit in a chair, discuss your goals, and then you just have to trust a verbal promise. You're committing to a permanent change based entirely on guesswork. Digital smile design functions as a rigorous planning protocol. It generates a high-definition simulation of your new smile directly on your own face, allowing you to review the aesthetics before any physical work begins. We are going to walk through the exact step-by-step process of how this works. You'll see how a clinic captures your data, how the software maps your proportions, and how you approve the final design. This shift moves cosmetic dentistry away from a doctor's subjective eye and toward a transparent, data-backed visual contract between you and your provider. Looking at this checklist, the first step happens before the simulation even starts. You need a stable foundation. If you have active gum disease, untreated cavities, or a severe bite misalignment, a responsible dentist will require you to address those first. Once your oral health is cleared, you bring in reference photos of smiles you actually like. But there is a strict rule here. These photos must be completely free of digital filters. Heavy filters and editing apps alter your true facial dimensions. If you feed that distorted data into the system, you actively sabotage the software's ability to map out your genuine proportions. You also need to verify your clinic's hardware. Make sure they use a genuine 3D intraoral scanner, rather than just snapping a few pictures and running them through a 2D photo editing app they label as a digital design. A perfect cosmetic digital simulation is useless if it is built on top of a failing biological foundation or inaccurate clinic technology. Your first real appointment takes 45 minutes, and it is dedicated entirely to capturing raw data. The dentist will take a structured series of high-resolution photos and short videos. They want to catch you in unposed, natural moments, like mid-laugh, to see exactly how your lips and facial muscles move dynamically. Next comes the digital impression. Instead of biting down on a tray of messy impression putty, the dentist uses a sleek digital wand that passes rapidly over your teeth, mapping a highly detailed 3D mesh model of your bite in real time. This digital workflow eliminates the DAG reflex triggers of physical molds, while also stripping away the margin for clinical error from physical materials shrinking or warping. By removing physical putty from the process, the dentist generates a highly accurate digital replica of your mouth to anchor every stage of the treatment. After you leave the office, the architectural work begins. The dentist takes all of your captured media and feeds it directly into specialized software. This diagram shows what happens inside the program. At the micro level, the software calculates exact tooth proportions and carefully traces the contours of your natural gum line, establishing strict width and height ratios. Then, the analysis expands outward. The system measures your lip line and maps your overall facial symmetry, anchoring the specific position of your teeth to the wider structure of your eyes, nose, and chin. The algorithm synthesizes all of these data points to generate a highly realistic 3D mock-up of what your completed treatment will actually look like. Because this process relies on rigid geometric mapping, rather than pasting a generic set of teeth over your photo, the resulting smile is engineered specifically to fit your face. Step 3 is the review appointment. This is where you see the simulation, and there is one critical rule you must follow. Demand to view the mock-up on a large screen. Reviewing the design on a small smartphone display makes it incredibly easy to miss subtle proportion errors that will become glaringly obvious once the teeth are actually in your mouth. Take a look at this clinical monitor setup. In one reported case, a patient came in to review her simulation and was presented with 3 distinct variations side by side on her own face: subtle whitening alone, a plan with 4 upper veneers, and a wider 8 veneer plan. Seeing them fully rendered, she immediately noticed that the 8 veneer plan looked artificially perfect. It clashed completely with her natural face shape. Instead, she confidently selected the 4 veneer option. She could only make that decision because she had a concrete visual reference, proving exactly what suited her features. If you are unhappy with the initial design, you and the dentist can make revisions digitally, right there in the chair, before a single tooth is touched. This review phase puts you entirely in control. You are giving informed consent to a concrete image, which drastically lowers the risk of waking up to a surprise result. Once you approve the final design, the clinic handles the handoff. They convert your digital file into a sequenced clinical plan, whether that involves clear aligners, porcelain veneers, or a combination of both. But here you face the complex risk of system drift. This happens when a clinic uses one software platform to design your smile, but the dental laboratory uses an entirely different software system to actually manufacture the veneers. To protect your results, explicitly ask your dentist if the simulation software and the fabrication software operate within the same closed digital ecosystem. Even the most precise digital mock-up is practically useless if the data is corrupted, misread, or lost during the translation to the physical lab. Before you book your consultation, you have one immediate financial action item. Check exactly how many digital revision rounds are included in the clinic's planning fee, as this varies widely between providers. Once the physical treatment is complete, maintaining the outcome becomes your responsibility. If your plan included orthodontic movement, you must wear your prescribed nighttime retainers consistently to prevent the teeth from drifting back out of alignment. You also need to maintain a strict schedule of routine cleanings. Your gum health directly dictates whether the gum line continues to look as natural over time as it did in the original simulation. Digital smile design provides a concrete blueprint, replacing the anxiety of the unknown with a highly predictable, personalized outcome. You deserve to see exactly what your future smile will look like before you commit to the procedure. Find a certified provider and book your consultation today to see the simulation on your own face.